Why are they always talking about connective tissues and tendons and the like on this channel? Like, what is their deal with this? And why do they keep relating it to isometrics? Does it really have anything to do with that at all? Oh boy, you better believe it. Let's get into this one. First, let's cover connective tissues, what all is involved with this, and then we're gonna tie it all into how they relate with isometric training. Connective tissues are integral components of joints, serving as the framework that supports movement, stability, and the overall integrity of the musculoskeletal system. These tissues include tendons, ligaments, cartilage, bursae, and the synovial membrane and fluid, menisci, and fascia. Each plays a specialized role in joint function, and understanding their detailed anatomy and physiology is absolutely essential for comprehending how isometric exercises are going to end up enhancing joint health and integrity. Let's start with tendons. Tendons are dense, fibrous connective tissues that attach muscles to bones. Composed predominantly of type 1 collagen fibers arranged in parallel bundles, tendons are designed to transmit the tensile forces generated by muscle contractions to the skeletal system, facilitating movement. The hierarchical structure of tendons, from collagen fibrils to fibers, fascicles, and the entire tendon, allows them to handle high mechanical loads while maintaining flexibility. Tendons contain tenocytes, which are specialized fibroblasts that are responsible for the synthesis and maintenance of the extracellular matrix, or ECM. The ECM consists of collagen fibers, elastin, proteoglycans, and glycoproteins, providing structural integrity and elasticity. Tendons have a limited vascular supply though, primarily at the myotendinous and osteotendinous junctions, which contributes to their slow healing rate when injured. Tendons also contain sensory nerve fibers, including mechanoreceptors and nociceptors, contributing to proprioception and pain sensation. Next are ligaments. Ligaments are strong bands of fibrous connective tissue that connect bones to other bones and joints. Similar in composition to tendons, ligaments are rich in type 1 collagen but have more varied fiber orientations to resist multi-directional stresses. Ligaments stabilize joints by restricting excessive or abnormal movements, maintaining proper alignment of bones. Fibroblasts within ligaments produce and maintain the ECM we talked about earlier. Ligaments contain Ruffini endings, Pacinian corpuscles, Golgi tendon organs, and free nerve endings, providing proprioceptive feedback and contributing to reflexive joint stabilization. Due to a limited blood supply, ligaments heal slowly, just like with the tendons, and injuries can lead to chronic instability if not properly managed. Next is cartilage, which is a specialized avascular connective tissue found in joints, primarily in the form of hyaline or articular cartilage and fibrocartilage. Articular cartilage is the cartilage that covers the ends of bones in synovial joints, providing a smooth, low-friction surface for articulation and distributing loads to underlying subchondral bone. It consists mainly of type 2 collagen, unlike the first two, proteoglycans such as aggrecan, and water, divided into superficial, middle, deep, and calcified zones, each with distinct cellular arrangements and collagen fiber orientations. The sole cell type in cartilage responsible for synthesizing and maintaining the ECM are called chondrocytes. Cartilage also needs to be nourished, and they rely on diffusion from synovial fluid due to its avascular nature. Fibrocartilage, which we talked about a little bit earlier, found in structures like the menisci and intervertebral discs, combine the properties of cartilage and dense connective tissue. It contains both type 1 and type 2 collagen, providing tensile strength and resistance to compressive forces. Next, we have bursae. Bursae are small, fluid-filled sacs lined with synovial membrane and filled with synovial fluid. They are strategically located at points where muscles or tendons glide over bones or other tissues. Their function is to reduce friction, facilitate smooth movement, and cushion pressure points between bones and soft tissues. They're classified as adventitious, developed due to abnormal stress, subcutaneous, submuscular, and subtendinous bursae based on their location. Inflammation of a bursa, which is called bursitis, which we may have heard about before, can result from repetitive motion, trauma, or infection leading to pain and restricted movement. The synovial membrane lines the inner surface of the joint capsule in synovial joints and is responsible for producing synovial fluid. The inner layer containing synoviocytes, type A and type B cells, is called the intima. Type A synoviocytes are called macrophagy, like cells involved in phagocytosis. Type B synoviocytes are fibroblast-like cells that synthesize hyaluronic acid and lubricin. In addition into the intima, there's also the subintima, composed of loose connective tissues with blood vessels, lymphatics, and nerves. The synovial fluid is composed of a viscous fluid containing hyaluronic acid, lubricin, proteinases, and collagenases. Its function is to reduce friction between articular cartilage surfaces, supply nutrients to avascular cartilage, and remove metabolic waste, and lastly, distribute mechanical stresses during movement. Menisci are crescent-shaped fibrocartilaginous structures within certain joints, such as the knee. The menisci has four functions. One would be load transmission, where the point is to increase the contact area between femoral and tibial condyles, reducing stress on articular cartilage. Function 2 is shock absorption, where the goal is to distribute compressive forces during weight-bearing exercises. Function 3 is joint stability to enhance congruency and reduce the potential for joint displacement. And function 4 is lubrication, where the goal is to aid in the distribution of synovial fluid that we mentioned earlier across articular surfaces. When thinking of blood supply with the menisci, we have the red zone, which is a peripheral zone, and the white zone is the central zone. The peripheral zone is vascularized, allowing for some healing capacity, while the central zone is avascular, limiting healing potential. Fascia is a sheet or band of connective tissue that envelops, separates, or binds together muscles, organs, and other soft structures. The composition of fascia consists of collagen fibers, primarily type 1, and elastin, providing both strength and flexibility. It serves three functions. The first is force transmission, which is going to facilitate the transfer of muscular forces across different regions. The second is support and protection, where it's going to maintain structural integrity and protect underlying tissues. And lastly is proprioception, where the fascia will contain sensory receptors contributing to body awareness and movement coordination. Lastly, we have the connective tissue cells and extracellular matrix, or ECM, that we mentioned a couple minutes ago. The connective tissue cells include fibroblasts, chondrocytes, tenocytes, and synoviocytes, each responsible for producing and maintaining the ECM of their respective tissues. The extracellular matrix, or ECM, consists of four moving parts. The first is collagen fibers, which are going to provide that tensile strength and structural support. Second are the elastin fibers, which impart elasticity, allowing tissues to resume shape after deformation. The third are proteoglycans and glycosaminoglycans, or GAGs, which contribute to the hydration and compressive strength of connective tissues. And lastly are the glycoproteins involved in cell adhesion and signaling within the ECM. That is a lot of exercise science. Now, feel free to reference this video at any point if you ever want to learn about each of those particular parts of our body's connective tissue. Trust me, this is just me being an exercise science nerd and being a personal trainer. But now we need to understand how exactly all of what we just talked about and learned is related to isometrics, and how those functions are improved significantly by simple static contraction. Now, our isometric exercises, whether yielding or overcoming, have significant implications for the health and integrity of connective tissues within joints. The first will be mechanotransduction, which gets split into two parts. The first would be cellular response. Isometric loading stimulates mechanoreceptors and mechanosensitive pathways in connective tissue cells. For example, tenocytes and fibroblasts that we mentioned earlier, leading to increased synthesis of collagen and other ECM components. The second would be tendon and ligament adaptation. Enhanced collagen cross-linking and fiber alignment improve tensile strength and stiffness, allowing tendons and ligaments to better resist mechanical stresses. Second would be articular cartilage maintenance, which also gets split into two parts. The first will be nutrient exchange. Compression and decompression during isometric contractions facilitate the diffusion of synovial fluid, delivering nutrients to chondrocytes and removing waste products. Speaking of chondrocytes, there's the chondrocyte activity. Mechanical loading maintains the chondrocyte function and ECM turnover, which is absolutely critical for cartilage health. If you want them to last longer, this will be a really good reason for that. Third reason would be synovial fluid dynamics. Lubrication enhancement occurs where increased joint pressure during isometric exercises is going to end up promoting the spread of synovial fluid over articular surfaces, reducing the friction. Then of course there's joint homeostasis in that synovial fluid dynamic, which is going to end up maintaining the optimal viscosity and composition of synovial fluid, supporting joint nutrition and function. Then there's proprioceptive improvement. This is gonna first improve your neuromuscular control because activation of those mechanoreceptors we talked about earlier within connective tissues enhances proprioceptive feedback, improving joint position sense and coordination, which is heavily slept on when it comes to the realm of fitness, which leads into its second function, stability enhancement, strengthening of muscles and connective tissues, which is going to contribute to dynamic joint stability, reducing the risk of injury. Lastly, there's reduced joint stress. Isometrics are going to minimize the shear forces during your workouts. The static nature of isometric exercise limits joint movement, decreasing shear stress on articular cartilage and bursae. And if you haven't seen our video on mechanical abrasion, I highly recommend you check that out right here. Reducing joint stress is also going to allow for safe rehab, in which it allows for strengthening without exacerbating existing joint pathologies or overloading healing tissues. I know when I get nerdy with exercise science terminology, I can sound like I'm speaking a different language, but if we simplify all this, isometrics end up enhancing connective tissue adaptation, it improves proprioception and stability, it supports joint nutrition, and it reduces injury risk. These are all huge reasons why everyone should be throwing isometrics into their workout routine. Whatever they're doing, add these isometrics into your workout routine. Your body will thank you. You will notice differences within 30 to 90 days for sure. Where your body will really thank you is decades from now, because your joint integrity is going to be in a much better place versus someone that didn't train isometrics.